Hi guys, today we study about congenital heart disease. Definition: important neonatal adjustments occur immediately after birth when the newborn infant starts to adapt himself to extrauterine conditions. In about 80% of children, the diagnosis of having a congenital malformation of the heart can be found out by a proper history and a well conducted physical examination supplemented by screening and ECG test of the child. Incidence: the overall incidence of congenital heart disease is about 6 to 8 per 1000 live births and 1 for 1000 at 10 years of age. Between birth and 10 years, 2% of total death is due to congenital heart diseases. Etiology: hereditary factors. Other congenital malformations are sometimes associated with congenital heart disease. Mothers who have viral disease like German measles, mumps in the first 3 months of pregnancy are more prone to give birth to children with multiple congenital anomalies. Radiation effects, maternal diabetes. Classification of congenital heart disease. There are various concepts related to classification of congenital heart defects. According to old traditional classification, congenital heart defects are divided majorly into categories: cyanotic and acyanotic defects. But this method in clinical practice have various problems because some children who are having acyanotic congenital defects also shows cyanosis and more clinical signs of congenital heart failure because some defects are complex in nature and have the variability of the clinical manifestations. So these systems is inadequate. Nowadays a more important classification system in followed which is based on hemodynamic characteristics or movements involved in circulation of blood. The characteristics involved are: first one, increased pulmonary blood flow; second one, decreased pulmonary blood flow; third one, obstruction to blood flow out of the heart; fourth one, mixed blood flow. Today hemodynamic classification system is more acceptable because the clinical manifestation of each group are more equal and good in predictable. Congenital defect which allow blood flow from the high pressure left side of the heart to the lower pressure right side and from left to right stone, which result in increased pulmonary blood flow and cause congenital heart failure. Obstructive defects impede blood flow out of the ventricles. Obstruction on the left side of the heart result in CHF, and severe obstruction at right side cause cyanosis. Defects which cause decreased pulmonary blood flow result in cyanosis. Mixed lesions present a variable clinical picture based on the degree of mixing and amount of pulmonary blood flow. Cardiac defect severity can produce CHF and hypoxemia. These can occur alone or together. Providing nursing care is very important and nurses can play a vital role in the identification and supporting management of congenital heart defects. Classification of CHF divided into two: acyanotic and cyanotic. Acyanotic divided into two: increased pulmonary blood flow, obstruction of blood flow from ventricles. Cyanotic divided into two: decreased pulmonary blood flow, mixed blood flow. Under increased pulmonary blood flow, there are atrial septal defect, ventricular septal defect, patent ductus arteriosus. Under Obstruction of blood flow from ventricles. There are coarctation of aorta, aortic stenosis, pulmonary stenosis. Under decreased pulmonary blood flow, there are tetralogy of phallus, tricuspid atresia. Under mixed blood flow, there are transposition of great arteries. Clinical features of congenital heart disease. Cyanosis. In congenital heart disease, there is mixture of oxygenated blood with deoxygenated blood, resulting in central cyanosis. Cyanotic spells are life-threatening if not treated in time. Clubbing occurs. Clubbing is pronounced in children with congenital heart disease of a cyanotic variety. Squatting is the characteristic posture adopted after exertion by ambulant children with a certain type of congenital heart disease, especially phallus. Ventricular overload. Ventricular overload occurs in aortic stenosis, coarctation of aorta. This is often well tolerated and may not manifest because the left ventricle is capable of withstanding a huge workload, but this adaptability may suddenly fail and result in sudden death. Systolic overload at the right ventricle, on the other hand, produces several warning symptoms: external dyspnea, fatigue, cyanosis, etc. Inadequate cardiac output may result in congenital cardiac failure or death in early infancy. Suboptimal development. Congenital heart disease may result in various degrees of physical development. Recurrent respiratory infection. It occurs due to pulmonary congestion, focal spaces. Focal spaces of the teeth, tonsils and ears lead to increased complications and morbidity. Bacterial endocarditis may supervene on any of the congenital heart defect. Associated anomalies: Down syndrome, Turner syndrome, etc. Preoperative management. Preoperative assessment. The preoperative assessment includes the history and physical examination, preoperative studies, baseline vital signs, measurement of height and weight, and additional nursing observations. Preoperative teaching. The goal of preoperative preparation include helping the parents and child deal with an unfamiliar situation, reducing the trauma of the experience and promoting growth and coping ability. This preparation should be planned and documented in the nursing record. Introduce the child to the environment, introduce to the equipment, introduce to the post-operative procedures. Post-operative management. The child is transferred to the intensive care unit or the recovery room for 24 to 48 hours or longer until the vital signs and all systems of the body are stabilized. While planning care for the child who had cardiac surgery, special consideration should be given to provide adequate rest for the child and visiting by parents. The observations that are to be made and the procedures that are not be done are discussed. Post-operative assessment. Post-operatively prophylactic antibiotics may be administered for several days to prevent infection. Electrolyte therapy such as calcium and potassium may be given to promote optical cardiac functioning. Digoxin is given when indicated. Post-operative assessment and management. Cardiac pulmonary functioning, gastrointestinal and renal functioning, central nervous system functioning, possible post-operative complications, teaching of family members for discharge. Thank you for watching my video. If my video is helpful for you, please like, share and subscribe my channel.